video recording of His Excellency the Prime Minister of the Federal Democratic Republic of Ethiopia, a laureate of the 2019 Nobel Peace Prize, who will provide the keynote address at this opening session. Secretariat, please show the video.
Dr. Tedros Adhanom, WHO Director General, Dr. Moeti, WHO Regional Director for Africa, Honorable Ministers of Health, distinguished participants of the 78th Regional Committee meeting, ladies and gentlemen. Allow me to first greet you with the humble Ethiopian expression, Tena Yistilling, which means health be upon you. My regrets that I could not join you for the live session. Excellencies, for the past 8 months, our world has been challenged and shaped in a profound way by the COVID-19 pandemic. This pandemic, which has rapidly spread globally in a short period, has affected millions and claimed the lives of thousands of people. This virus has not only affected our health, but also tested our way of living, societal norms, and economies at large. It prevented us from sending our children to school, limited our societal gatherings, and the act of worshiping together. It also gravely impacted the economies of countries with a decline in GDP growth, high inflation, high unemployment rate, reduction in household income, increase in poverty rate, and others. COVID-19 does not recognize borders, does not differentiate between religions, economic status, or the color of our skins. It has affected all of us. As the Director General once rightly said, it is a common enemy of mankind. In Africa, we quickly felt the impact of the pandemic due to our weak health systems, coupled with the highest disease burden in the world. The World Health Organization declared the coronavirus as a global pandemic on March 11, 2020. In response to this global health threat, my government took decisive measures to minimize the impact of the pandemic on our society and the economy. The measures we took were intended to protect Ethiopia from this devastating virus and to delay the spread on our continent. As early as January 2020, we successfully activated all necessary precautionary measures at Bole International Airport, one of the largest hubs in the continent. Similarly, the action we took to control the spread of the disease once it was detected in Ethiopia were inspired by the concept of solidarity and collective leadership, embodying the spirit of Maddamar or synergy, which I have been championing nationally and globally. In accordance with the spirit of Maddamar, together with JACMA, we were able to mobilize 5 rounds of COVID-19 prevention material support to numerous countries in the region. In this difficult time, Ethiopian Airlines has proven that it is an African airline by providing cargo services to deliver life-saving emergency medical supplies from the rest of the world. As you are aware, we are still faced with challenging days as the coronavirus races through our continent. To minimize the effects, I would like to share 3 very important points for the way forward. First, we need to enhance our efforts in a much coordinated manner with utmost cooperation and in the spirit of solidarity. Secondly, we need to develop a common voice to ensure fair and equitable access to COVID-19 vaccines, diagnostics, and treatment. Here I would like to thank the WHO for initiating the ACT Accelerator Program and together with Gavi and COVAX initiative. Africa should be placed at the center of these initiatives. Third and last, let us take this opportunity to strengthen our health systems and further enhance our public health emergency preparedness and response capacity. COVID-19 has taught us that strong health systems are a matter of national security and survival. And I propose the health security agenda be elevated to the top of priorities at the African Union and other regional intergovernmental organizations. Ladies and gentlemen, finally, I would like to recognize the important work of the World Health Organization for their leadership and support to member states during this pandemic. I would like to acknowledge the Director General, Dr. Tedros, and his team, and our Regional Director, Dr. Moeti. Your support has been imperative. I would also like to take this opportunity to thank Commissioner Amir El Fadi, Commissioner of Social Affairs for the African Union, and Dr. John, Director of African CDC, for their relentless follow-up and action which helped countries to minimize the dire impact of the pandemic in our continent. My utmost appreciation to you, Ministers of Health and health workers in general. Your role is invaluable. Let me conclude by wishing this August Assembly successful deliberation. Amasagnallo. I thank you.